This lecture is on achieving quality through research. According to the National Institute of Nursing Research develops knowledge to build the scientific foundation for clinical practice, prevent disease and disability, manage and eliminate symptoms caused by illness, and enhance end-of-life and palliative care. There are 7 steps to evidence-based practice. We will go through each one individually on the next slides. Number 1 is thinking of a problem. You need the precise definition of that problem. Number 2 is decide what is needed to help solve the problem. 3 is to complete a literature review. 4, think about, does this apply to us, or will the evidence be pertinent to nursing? 5 is determine if a change is necessary as it applies to the patient. 6 is changing protocols and developing guidelines. And 7 is evaluating its effectiveness. There are 2 types of research designs used by nursing. Qualitative research is organizing and interpreting data of non-numeric form for the purpose of discovering underlying dimensions and patterns of relationships. So think about quality. Focus on discovery rather than verification. Focus on feel and experience. Interviewing is the main technique used. An example is, what is the nature of coping and adjustment after radical prostatectomy? And then quantitative research is the manipulation of numeric data through statistical procedures for the purpose of describing phenomenon or assessing the magnitude and reliability of relationships. Quantity has an N in the word. Use N for numeric or numbers. With quantitative research, you focus on how many and how much. An example is, are there differences in skin breakdown with premature infants bathed in plain water versus with bacteriostatic soap? So, step 1, state your research problem as a question. Let's take a closer look at these steps. With step 1, you need to narrow a broad area of interest to a problem that specifies the exact intent of the study. This can be a problem in practice, a contradiction, or an area where minimal research has been done. The criteria should include the significance to nursing. Can it contribute to patient care or resolve a problem? Should also include researchability. Would this be realistic? Can it produce generalizable information? And the criteria should include feasibility. Would you have the available time, resources, and people to perform the study? Now, this cannot be a yes or no question. Example, do dying children have spiritual needs? A better question is, what type of spiritual needs do dying children have? It cannot be a should, would, could, or value question, like should all diabetics learn to give insulin? A better question is, what type of education do diabetics need for effective health management? So tell me, is this a good question? What is the main factor causing premature births with low-income mothers? Sure it is. How about, what are the stages of grieving? Is that a good question? Sure it is. Okay, so let's do a little practicing. Think about these questions. Are they researchable or non-researchable? So the first, what impact does ice water have on patients with myocardial infarctions? That's researchable. Yep, for sure. The next one, should all diabetics learn to give themselves insulin? It is not. First of all, it starts with should. Second of all, it's a yes or no question. The third one, what are the attitudes of labor and delivery nurses toward nurse midwives? Is this researchable? Sure it is. And the last one, do dying children have spiritual needs? We already used this question, and no, it was not researchable. All right, so step 2 is the purpose statement. This should be a summary of the overall goal of the study, and it should start with, the purpose of the study is to... All right, so throughout this presentation, we're going to use a research example. And we're going to use this study. It is the purpose of the study, and this is our study we're going to use, is to discover the thoughts, feelings, and attitudes of newly divorced men living apart from their children. All right, with step 3, this is the literature review. So your review has to be comprehensive, including early research to current data. Has to provide a foundation to base your knowledge, show gaps, and should support the need for your idea. You should do some narrowing before you go to the library. Think about key terms and be prepared to narrow or expand your search depending on what you find. Plan to spend some time in the library, but don't waste time. Get a librarian to assist you if you need to. Begin by identifying major professional nursing journals that publish nursing research and start there. If your problem's in a specialty area, start in the specialty journal. If you find one article related to your problem, look at the author's reference listing for other articles. And look at the table of contents in the journal where you found one related article. Primary sources are the person that conducted the research. Okay, again, for our research example, these are examples of key terms relating to our statement of purpose about the divorced men. And these are what I would use when I go in and start my research. So key terms would be divorce, child support, father versus child relationships, life adjustments, marriage, and custody. And I would use these terms and see what I could find for my research. All right, step 4 are defining variables and formulating a hypothesis. So first of all, what are variables? They're concepts. They vary or change in value, like weight, blood pressure and anxiety, temperature, and feelings. A variable is any quality of a person, group, or situation that takes on different values. There are 2 different types of variable. A dependent variable is behavior, characteristic, or outcome that researchers wishes to understand, explain, or predict. The independent variable is the presumed cause or influence on the dependent variable. So variables need to be measured and measurable. And then our hypothesis is a prediction of the expected outcomes. It should be worded in simple, clear, and concise language and should provide a definition of the variable in concrete operational terms. So let's talk about the independent and dependent variables in these situations. The first one, what is the effect of alternative non-dieting interventions on eating restraint and body dissatisfaction among obese women? So what is the dependent variable? That would be eating restraint and body dissatisfaction. And what is the independent variable? It is alternative interventions. Do you see how the eating restraint and body dissatisfaction is dependent on the alternative interventions that would be done? The next one, is abuse during childhood related to women's victimization throughout adulthood? So the dependent variable is childhood abuse, and the independent variable is women's victimization. The childhood abuse is dependent on women's victimization. Do you see how that's going? All right, let's try this one. What is the effect of regular active exercise during the last trimester of pregnancy on maternal weight gain and infant birth? What is the dependent variable? The dependent variable is maternal weight gain and infant birth weight. What is the independent variable? Amount of exercise. Absolutely. The dependent variable is going to change according to the amount of exercise, which is the independent variable. All right, so let's look at our research example again. These are the dependent variable, thoughts, feelings, and attitudes. The independent variables, the fathers living apart from their children. And our hypothesis is fathers that are newly divorced will experience deep grief, frustration, anger, pain, and a sense of loss when living apart from their children. That is what we are going to try and prove with our research. All right, step 5. Research design is the overall plan for obtaining answers. So, what is a research design? You've got a couple different ones. First of all, experimental. Your independent variable is manipulated by administering experimental treatment to some while withholding from others. So the example we're going to use in these are 8 ounces of prune juice is given to one group and a regular diet is given to one group. Which of them had improved elimination patterns? So you see where we're manipulating the independent variable of prune juice to see what difference this is going to make on the dependent variable, which is elimination patterns. All right, in a quasi-experimental research design, our independent variable is manipulated, but subjects are not randomized. So this is also called a convenience sample. And the prune juice is given to all residents who have elimination issues. And then in a non-experimental research design, you're going to collect data without manipulating independent variables or controlling any subjects. So our data is collected regarding elimination patterns for all residents in this one nursing home, including the current use of prune juice versus regular diets. So those are the 3 typical research designs that we would use. Step 6. So we're going to select a population, sample, and setting. A population is going to be all possible members who meet the criteria for your study. The sample is going to be the subjects from whom the data is going to be collected. And then you have to think about how you might obtain your subjects. So it can be a random sample, a sign-up, an advertisement in a newspaper, collecting people or data from people at work, or in a certain healthcare setting. And then how are you going to safeguard their rights? That's always important to think about in a research situation. All right, so a random sample is selection using random principles. An example of this is taking all names in the phone book, and every 10th name will be in our sample. There are computer programs that can also assist with this process. A non-random sample is your convenient sample, as in our quasi-experimental example earlier. Generalizability is the degree in which the research findings can be generalized from the sample to the entire population. So ask yourself, would research on this class yield results that would be generalizable to all? So an example is, if you're measuring patient satisfaction, should represent the entire hospital population, including young, old, middle-aged, chronic, and acute. All right, so this is our population and sampling for the research study about divorced men. The population is men newly divorced within a year, and the sampling is going to be men in Wausau, Wisconsin, that voluntarily sign up for this research study at the clerk of court's office. It's non-random. Does that kind of pull it all together for you? Okay, so human subject protection. They have the right not to be harmed, physically, emotionally, legally, financially, or socially. Your subjects also have the right to full disclosure and the right of self-determination. For anonymity, you should use code names or numbers to ID your subjects. For confidentiality, your subjects' information should remain protected. And for privacy, the information will not be used to embarrass someone. This will allow subjects to behave normally without the concern of future replications of their behaviors. All right, so are these anonymity, confidentiality, or privacy? In a study of patients with arthritis, the researcher used real names in her field notes. This is anonymity. In a study of nurses rating weekend versus weekday work schedules, the researcher permitted nursing administrators to examine the raw data. This is confidentiality issue. And the last one, the patient was afraid that what he said in the questionnaire would be used against him, which would affect his care. And this is a privacy issue. All right, step 7. A pilot study is a trial run. It's typically on a small sample to test the plan. The goal is to assess problems and feasibility, and also to assess validity and reliability of the instruments and the tools. Validity is the instrument measuring the intended anxiety, or is it measuring their stress or fears? You have to make sure the tool you use is valid. Reliability is in a thermometer to measure fridge temps. If it's placed many different times, does it always come out to the same measurement each time? That's reliable. Next, in step 8, we're going to identify what tools you will use to collect the data. You can use different tools like questionnaires, rating scales, interviews, observation, and biophysical measures. And there's many, many more. Alright, so collecting data. How are you going to collect the data? Are you going to observe? Are you going to use focus groups? Are you going to interview, use surveys? There's a number of different ways that you can collect your data. So think about that if and when you do a research project. And then step 9 is data analysis. Now, descriptive statistics are procedures that summarize large volumes of data showing patterns or trends. The mean is the average, the median is the exact middle, and the mode is the number occurring most often. Standard deviation is the average in which scores deviate from the mean. Inferential statistics are more complicated. The differences, an example is t-tests and chi-squared. Relationships, an example is Pearson's correlation. And outcomes, an example is regression analysis, factor analysis, or path analysis. And then clinical significance. Probability is less than 5%. This is acceptable level of significance. It means that the probability of findings being caused by chance alone are less than 5%. And so that's okay for research. All right, with our example, this is the data analysis plan for our divorced men study. Descriptive analysis was used. It's a measure of central tendency, will be used to highlight the most common feelings and reactions of these men. The most common findings will be presented using percentages. And so now step 10, and I know initially there were 7 steps that I told you about, but some of them were broadened out a little bit. So step 10 is necessary in research to identify what went wrong and how this information is going to be used. And then finally, where will you communicate your findings? Which journal are you going to put them in? Alright, so this concludes the steps in the research process. It really was just meant to show you how a research project is completed.